Let's go ahead and get going. It's 3 o'clock, so go ahead and start the recording, please. Or you already did.
It's good. It automatically is now.
Okay. Thanks, Lisa. Hi, everyone. Good to see you all again. Let's go to roll call. And Valerie, are you here?
I am.
Okay. Linda Winstanley, I saw you earlier. You're here. Linda? She might be muted. Julia Weinberg. Okay, Grant, I see you.
Yep.
Hi, Grant. Linda Whitney. I see.
I'm here, but my video isn't working, so I'm sorry.
That's no worries. It's all good. Thanks, Linda. Miranda contacted Lisa and I earlier. She may not be able to make it, so she has an excused absence. Kirsten.
I'm here.
Amber Bowman, I see you as well. Hi, Amber.
Hi.
And then Seamus contacted me yesterday, and he won't be here.
I cannot hear.
I can hear you. Looks like your volume's off. You're muted.
I know, and I can't hear you. I'm not sure. Let's see. I'm here.
Okay, we'll give you a minute to see if you can figure it out.
Looking for it. Can you still hear me?
We can hear you, Linda. Can you hear us now? No. Randy, while she works on that and to kind of keep.
I've got it now. Yeah.
You got
Okay,
it?
perfect.
Perfect. Okay. All right,
Perfect.
Linda Winstanley, you're here. Got you. And then I just catching up with you, Linda. So we have Julia Weinberg and Miranda. Julia Weinberg is not here. We have Miranda and Seamus who have excused absences. And so we do have a quorum present, so we shall continue, and we'll go to Commissioner Thompson.
Thank you.
Are you here?
I am.
Glad you're here. Good to see you.
Thank
We'll chat with you a little bit further on.
Okay.
And Jill Quackenbush. I don't see Jill. Okay. Lisa, I know you're here.
Jill's here. She's just off camera right now, but I can see her. And yeah.
Oh, I see her. Okay, great. And then Monica, you're here. And then Shira just sent a message in. I didn't see what it said.
It says
laryngitis.
Oh, okay. All right. So Shira is not going to be available today. Lori Moore, are you here? I don't see Lori either. Okay. We'll move on then. We do have one guest present who's just going to listen in today. She was interested in our group. Her name is Christy Peschel, and she's just listening in. So let's move on to approval of the agenda.
Randy,
Yes.
I'm sorry. Jill has her hand up.
Oh, hi, Jill. Sorry, I was looking at my agenda.
That's okay. Hey, I was just getting some calls. It sounds like there's a group of students that are in the building in person that wanted to also attend the meeting. So we're going to send them the Zoom link. But I just wanted, if you see them coming in, I wanted to give you a heads up on that.
Perfect. Thank you.
Yep.
Jill.
These are students that we see regularly at the end of the year who have a government requirement to attend meetings. And
Nice.
so they go on the website and they find all the meetings, whether it's a Board of Commissioner meeting or any other public meeting. So we're going to give them a government experience.
Perfect. Love it. Good for them. Okay. Let's move on to the approval of the agenda. Does anybody have any questions, comments, additions on this month's agenda? If not, then I need a motion to approve the agenda as is.
I motion to approve the agenda.
Second,
I'll
I
second.
second it.
motion has passed to accept the agenda as is. Let's go to the April 3rd minutes. Any questions, comments, additions, deletions, anything on the April minutes? If not, then I need a motion to approve as is.
I'll move. We approve the agenda as presented.
Okay, second,
I'll second it.
okay, there you go. Motion has passed. And we'll go to public comment. I don't believe we have any guest from the public. Who's that?
Carrie has come into the meeting since then as well, but I guess she's CBH, so she's not
Oh, okay. Yeah, I see her.
a
Hi,
standby
Carrie.
guest.
Okay, let's move on. Public comment. We don't have anybody that wants to speak at this point. Presentation. We have Susan Bjarnson. I hope I pronounced your last name right. From Northwest Senior and Disability Services, the new director. Susan, welcome, and you have the floor for about 10 minutes.
Wonderful. I don't know how much of you guys know about Northwest Senior Disability Services, but my name is Suzanne Bjarnson, so it's pretty close. And I am the program manager here for Northwest Senior Disability Services, and I've been with the agency for 10 years. Started as case management, and then into our community programs, and now into the program management. And so I'm guessing you guys just kind of want a rundown of what Northwest Senior Disability Services is, what we do here in the county and whatnot. If you guys have questions, just let me know. I don't mind if you interrupt or anything comes up. I may not be able to see who has hands up or whatnot. But just real quick, because I've got some notes over here. I might be looking at my other screen just to make sure I don't miss anything. But basically, we're a local intergovernment agency. And so we serve 5 counties in Oregon. So obviously Clatsop County, we have Marion County, Polk County, Yamhill County, and Tillamook County. And so we're known as the Area Agency on Aging, and we're also referred to as Aging and Disability Resource Connection. And so that's throughout the whole state, actually even the whole country. It's kind of I sum it up as a one-stop shopping for when people have resource information they need, but if they need to get connected with services, that's where we send people to get started. Certainly they can come into our office, but that's a great place to start. Our funding comes from federal and state government, and we also receive some donations as well from individuals and community groups. And we, like I said, in our 5 counties that we serve, we also have a board of directors. So that consists of county commissioners in each of our counties that we serve in. And then there is also a senior advisory council and a disability services advisory council that helps advise the board as well. So what we do here in this county is we're often known as the Medicaid office. So we serve consumers who are aged, legally blind, or those who have disabilities. And we also offer medical coverage for employed persons with disabilities. And let me know if I'm going too fast. Our Medicaid services, so we can provide that for in-home and community-based care setting. A community-based care setting is going to be like our assisted livings, our adult foster homes, our nursing homes in the county. And there are guidelines that individuals have to meet. There's a financial component, and there's also a physical component where we look at the activities of daily living. So we have case managers that go out and make an appointments with our consumers, as well as eligibility specialists in our office that look at the financial component. Now, there is a lot of rumor, I feel like, that people think it's kind of apples to apples in applying for financial services. Oh, you have to be in this kind of category in order to qualify. There's a lot of different variables. So when in doubt, we just encourage people to apply and let us sort out that piece of it, and we'll meet directly with consumers. Let's see, we also have Medicare savings programs. I've worked with Linda Dugan in the past with our senior health insurance benefits assistant, so she's probably familiar with this side of it. We can help our consumers, people in the county, help pay for their Part B Medicare premiums, and also to help pay a portion of the whole medical as well. So when we have people that are on a lower income, we want them to come in and try to apply for these benefits to see if they do qualify, because there's a lot of, we find a lot of people that could qualify for having these Part B premiums covered for Medicare, and there's Medicaid that can pay for that. So we can kind of assist them in that portion of things. These programs, they're not full medical packages, but they can help people pay for their medical. Then we also are known as the SNAP office. So self-sufficiency here in the county does that as well. I should kind of rewind a little bit. The state of Oregon, we're kind of known as a storefront, no wrong door. So you can come into our office for other things beyond the SNAP and the Medicaid and things like that. We specialize in the long-term care for our seniors and people that are disabled, though, and with the SNAP benefits. But we can help the application process for a lot of benefits across the board. So that is important for people to know. We stay pretty busy in our location because we are located here in Warrenton, just down the street from the jail, the animal shelter, the food bank. So we receive a lot of traffic in our office, which is great. So again, we also have the SNAP benefits. So that is serving those under the age of 60 as well, but primarily in our offices, 60 and up, and who receive Social Security, disability, or supplemental security insurance. Individuals can apply online, in person, over the phone. And let's see, if they are receiving SNAP, they can claim medical expenses, and they might see an increase in their SNAP as well. So we will look at all of that, and we go over that with our consumers that come in. Then the other side of things, so that's kind of the Medicaid portion of it. We also are Older American Act programs, and I think a lot of people forget that we have that component because we're pretty much always known as the Medicaid office. But we help consumers over the age of 60 find resources and have assistance. We have a staff person in our office who's the community program supervisor. So that's helping individuals that might have aged family members, they might have an aged spouse. If they are an unpaid caregiver, we have programs to support them. We have educational programs. We network a lot with some of the hospitals and community programs in the county as well, with providing fall prevention, diabetes management, things like that, chronic conditions. Like I said, caregiving programs that can provide a little bit of assistance with family members, and it provides also basically kind of case management to help people through those hard times. So when in doubt, if somebody's going through a hard time looking for caregiving, they think they're over-resourced, they might be. We still have programs and we still have staff members that can sit down with them, help provide options counseling, which is really putting together a plan and helping them see the big picture. Maybe they're not ready to apply for Medicaid now, but maybe in a couple years down the road. We hate that, to have somebody spend down all their money, go move into a facility, and then they're not going to qualify down the road. So we can have someone sit down with them and go, you may not want to do that yet. Here are some options so you don't get yourself in a financial situation that you can't get out of. Let's see here. We also, like I did mention real quickly, our senior health insurance benefit assistance. So that's where we can help people with their Medicare options. So if somebody is trying to understand Medicare, they're new to Medicare, they can make an appointment in our office and we'll go over what their options are. We can help them choose Part D programs, their drug plan options. We can discuss their options for supplement plans. We can't sign them up, but oftentimes we put them in a position where they can make a choice, or else we'll assist them with the local brokers that we have in our county. So that's a great way for a lot of people who are overwhelmed with that process, just to have an expert on that side of things. We also have the meal sites in the county. So we have the Swenson Meal Site that oversees the Astoria area. We have the Warrenton Meal Site, and then we have a Seaside Meal Site. So that provides in home delivered meals. We've partnered with Meals on Wheels, so now we're known as Meals on Wheels Northwest. And so different parts of the county have different delivery days. So just call our office, or you can call our meal sites directly to get signed up for that as well. Let's see. Went over that. Any questions so far?
Suzanne, do you guys still have Sheba volunteers?
We currently do not have Sheba volunteers. However, we have the community program supervisor is Kim Combs in our office. She formerly used to be a quality assurance eligibility specialist, so she's got a good financial background and really understanding the qualification process, and so she will meet with people individually. Now, during our busy times, we will assist people to utilize our Sheba counselors in the Valley, because they can do Zoom calls, they can do phone calls as well. But Kim in our office right now, if it's not a busy season, she can take those on. So.
Okay, Amber has her hand raised.
Yeah, I have a couple questions. First question is, I'm wondering if you can tell us what your enrollment numbers are just for Clatsop County right now. And then I'm also curious how people typically become enrolled with you. How do they find you? How do they find out that this is available service to them? Do you guys advertise?
Good question. I have to do a quick little looking at my numbers. We have just under probably 400 people on long-term care services and support. So people receiving in-home care or people in facilities in the county. Then to get on services and whatnot, they can call us, they can go to the websites to get started in the process there. As far as advertising, we don't per se do any advertising. We work really closely with the hospitals, the social workers, word of mouth, the local self-sufficiencies, APD, DHS, all of them, and they come. The numbers come in. But doing things like this, our community program supervisor, she's out in the county, our meal sites, that the information just gets around. But yeah, definitely we can. I mean, we're not going to turn anybody ever away. We have our different times of the year that get pretty busy. A lot of the times we get a lot of phone calls after the holidays. Spring tends to be pretty busy for us too right now. So as far as numbers for food stamps and all that, I don't have that readily available. We could get that for you and get a better idea. But as far as long-term care services and supports, I'd say it's just under 400.
I would be very curious to see those other numbers. So if you're able to get them, that would be wonderful. Thank you.
Mm-hmm.
Suzanne, I have a question for you. If you can speak to the Meals on Wheels program, I understand funding is being cut on a federal level. What's that going to mean for our local Meals on Wheels program?
At the moment, we're not being affected. Everything is business as usual, and so there's not anticipation at the moment of anything that we're concerned about. So I don't have a lot of details on it, but that's really what our executive directors are letting our agency know.
Perfect. Good to know.
Yeah.
Thank you.
Yeah, same with our benefits across the board. We don't have any new information or news on any of that, but we're sitting good at the moment.
Good.
So we don't anticipate any concerns.
Wonderful news. I like that. Thank you.
Mm-hmm.
Any other questions or comments for Suzanne? If not,
Suzanne, when people call that ADRC number, the senior services number, are they still make appointments with you or DHS, or is it pretty much with you guys now? You know?
So ADRC, when they call that number, that's going to get directed with our agency, Northwest Senior Disability Services.
Okay.
So as I said, our agency is a 5-county agency. So that department is out of our Salem office. However, they're setting the appointments up directly with the offices that are impacted and that need the appointment. So the good thing about starting with ADRC is they're asking financial questions and getting everything started to see what is appropriate for a program to recommend and whatnot. So that's still the best way to go. We can start it at our side of things. It can be slower, oddly enough, from the office level when it comes to long-term services and sports. SNAP, they can come right on in. That shouldn't be a problem. And I should add, we also have the Adult Protective Services out of our office too. We have two case managers that do the Adult Protective Services out of here in the investigations. So. And those still go through a screening process too. People can call in directly, or they can go to our website to fill out the APS form, and then that goes through a screening process, and then from there it gets assigned to the APS case managers.
That's great. Okay, any other questions or comments for Suzanne? Amber has a question there. SHIBA, what does that stand for?
Oh, good question. That is. So it stands for Senior Health Insurance Benefits Assistance. The book, I do have a book right here. We have these out of our office. We have a few in Spanish as well. This is what the booklet looks like. You can get this online as well. This is a great resource because those Medicare and U books can be very daunting to go through. This kind of breaks it up, but still it can be daunting for people. But if we just go through and explain what the sections are, it's more easily to understand in that process. But yeah, if you're new to Medicare, switching over, we will definitely work with people and help it make sense, break it down.
Great. Any other questions or comments? If not, Suzanne, thank you very much.
There was a second part to that question. I just with some of those acronyms, I'm not familiar with them. So the SHIBA, and then also Linda, you had said about that phone line, the phone number that people
ADRC.
ADRC.
Mm-hmm. So that is Aging and Disability Resource Connection. So it's known as ADRC. Now, throughout the nation, it's Aging and Disability Resource Centers. So all the states have these in one form or another. Just like a lot of the states have a form of SHIBA. Sometimes it's known as SHIP. And I think California might be CHIP, if I remember right. So the states all have some sort of form of these. So those are where you want to connect. So if you have loved ones in other states and they're trying to find, something as simple as housekeeping, they can contact these centers to kind of get, okay, what is recommended, what is with logged in with the state, right? So those are good resources and good places to begin when people are kind of whole new to the system and they don't know where to start. Those counselors there should be able to kind of ask the questions to kind of find out what their need is. And then from there, when they get into the local offices, we'll specifically help meet their needs and whatever they're wanting to apply for.
Those are great resources. Thank you for clarifying.
Yeah, you bet.
Great. Any other questions or comments?
I just have a clarifying question, Susan. When we're talking about Northwest Senior Disability Services, we're talking about you all don't provide developmental disability services, do you?
Correct. So that would be
Yeah.
through Clatsop Behavioral or Integrative Services Network, ISN. We work with them as a community partner. Sometimes they might fall under our waiver. A lot of times, depending on what the diagnosis is or what they have or how their age as well, they're better served under that waiver versus ours. So we work with them to kind of have a determination. And so we will meet, it's very common we meet with people with developmental disabilities to determine should they come over onto our side. We'll meet with family members and they kind of decide what the best fit is.
Okay. I just wanted to, because this group works with the mental health and developmental disabilities. And so I just want to make sure when they understand the work that you all are doing and the work that CBH is doing on that contract.
Yep. And that's really important and that is kind of a gray area, and it will make case managers kind of pause and make sure that I don't know if this is the best waiver, but then we leave it up to the consumer to decide too of what route they want to go on. So we just have to provide them the information. It feels like depending on what is a lot of situations, CBH is still the appropriate way. Now, if they are aged, then we're definitely going to look at our waiver as well. But definitely is something that we have to look at and consider.
Thank you.
Okay. Any more questions or comments? Thank you so much for coming and a lot of good information.
Good. Well, let me know if you guys need anything else, and we're here for you guys.
Okay. Thank you.
Thanks, Suzanne. Thank you.
Take care.
Okay, let's move on to
Randy, can we go back to the roll call real quick? It looks like there's Elena Green who came into the meeting. Are they still here? I don't see them anymore. Okay,
Yeah,
we had a guest momentarily, and then I also wanted to point out that Julia is now here as well.
Okay, thank you. Hi, Julia. Okay, thanks for that. All right, let me get to my next page here. Okay, presentation discussion health equity plan for Clatsop County Public Health, and that would be Jill Quackenbush. Jill, your turn. You have the floor.
Right on. And then I think, Lisa, you're going to share my slides, right?
Yes.
I'm gonna do a quick kind of background of why we're doing this health equity plan, as well as our planning roadmap. I'm going to go through those two things really, really fast, but I'll provide these slides to you if you have any additional questions afterwards. And then, because what I really want to do is be able to provide the key priorities and get your feedback on those. So go ahead, Lisa. So the health equity plan is part of our public health modernization. And just a quick history of modernization. Public health modernization, it's the Oregon Health Authority's approach to ensuring that local public health departments like ours have a pathway to provide the optimum services to all. The state has been working on modernization since 2013, and in 2015, modernization was put into law. And then in 2017, House Bill 2310 further clarified what the framework looked like, including the foundational programs, which are communicable disease control, prevention, and health promotion, environmental health, and access to clinical and preventative services. And then the capabilities, which are leadership and organizational competencies, health equity and cultural responsiveness, community partnership development, assessment and epidemiology, policy and planning, communications, and emergency preparedness and response. That these were the capabilities that local public health departments needed necessary to protect residents, improve health, and achieve equitable outcomes for all. Next slide. Clatsop County Department of Public Health, we do receive funding from OHA, Oregon Health Authority, to implement the modernization framework. And as part of this funding, the county is required to complete a health equity assessment and health equity plan. We did a regional health equity assessment in 2021, and we partnered with Columbia and Tillamook counties to do that assessment. And the assessment described how different health factors such as housing, transportation, poverty impact health and the health behaviors in our region. The next step is for Clatsop County to complete the required health equity plan, which is essentially putting that assessment into action. We've contracted with Reed Group, who's a consulting agency who completed our assessment, and they have been working with us on our equity plan. Next slide. So our planning roadmap, we started out this year, January, February, just with initiation and planning. We met with our Board of County Commissioners, which is also our Board of Health, and Local Health Authority, and also began talking with other groups. Lisa did share with the Human Services Advisory Council that we were beginning this process, started working on data collection and analysis, and then working with our core planning team, we began some strategic planning and prioritization. And here we are today at plan development and refinement. Next slide. So I believe Lisa shared these key priorities with you in your email documents. These reflect community input from local and regional health assessments. They're also aligned with the state public health modernization goals. They also build on existing momentum in the county in areas that are identified for growth through either staff surveys or partner feedback. So family support and childcare, and again, remembering that the original assessment was done in 21, and I think you'll recognize that with some of these things, there's been like a lot of work in the community that is already occurring on some of these priorities. But this is so family support and childcare is a foundational determinant of health. So looking at how to support family-based support services, including childcare, especially for low-income and rural households. The second key priority that was identified was youth substance use. This is an emerging issue. There's a lot of existing momentum right now with community partners and with schools to reduce youth substance use, including tobacco, cannabis, and other drugs through school and community-based strategies tailored to groups most impacted. And then the last one that was prioritized was Clatsop County Department of Public Health internal organizational capacity for health equity. And this may look at, like how can we be engaging the community with our LPHA, our local public health authority, in decision making and planning? How can we improve culturally responsive services within our department, which may include linguistic services, and it may mean like doing feedback loops, doing more listening sessions out in the community, and then accountability mechanisms that really reflect our department's commitment to equity. Next slide. And then our next steps, we'll go back to those key priorities, but I want to also stop sharing so that we can talk about those priorities. But real quickly, the next steps are ongoing community outreach and input. So getting some input like from Human Services Advisory Council. And Lisa's been working on meeting with some other groups, and I'll let her kind of share what groups we are have committed to working with us on feedback. And then our final plan is due to the state by June 30th, and we will be going back to the county commissioners on first Tuesday in May, I think it is. I'm sorry, this is June, the first Tuesday in June, the first work session in June to share both the key priorities as well as the community inputs, because this at this point, this is our time where we can kind of massage and look at what does the community think about these priorities. So we can stop sharing unless anybody has any questions about the slides at this point.
Questions? Comments?
This is Linda. I do. Jill, I'm just wondering why, the homeless with the drug and mental health issues, why that's not on there. That's a huge county public health issue.
Yeah.
Why isn't it on your list? Yes.
So that did come out in the health assessment. And one reason it didn't come up on our key priorities is because there is a lot of momentum already in the community around that, and there's groups and efforts working on that. So it's not that we wouldn't address it at all, but for this health equity plan to be able to come up, we needed to be able to narrow that scope. And that was something that our group actually talked about, our planning committee. We did kind of go back and forth on that as well.
Because there needs to be a countywide coordinator, because they're talking about, pushing them from Seaside to Warrenton to Astoria back. There's not a county coordinator for them. Mm-hmm. And to me, that would be the public health department helping with that. So that's disappointing for me. Yeah. It's not on there.
I will just kind of speak to that. And so the county works actively with all of the cities. And when we started trying to address the shelter issue, working with the cities so that we had shelters and services in each of the cities, because we don't want to see them getting pushed from one location to the next. And so from a countywide position, the county can't tell the cities what to do in regards to their exclusion zones, their camping ordinances, or any of that sort of thing. And so when we were working with the cities under the direction of the board, it was to work with them so that way they have the shelters and the services within each of their cities should they choose to have them.
But Monica, this is the mental health and drug use. I mean, I understand the shelters. You guys have done a great job, and there's housing for everybody. Yeah. But some are choosing not to do that, and because of the drug and mental health issues. And nobody's addressing that at this point.
So yeah, I mean, that we can have further conversations about it, but we are, the county public health is different than behavioral health. And so we do contract with CBH to do behavioral health services. and drug treatment. And then the county does, within public health, does do the prevention aspect of it. So there is coordinated work, but unfortunately, we can't force people into treatment, whether it be for mental health treatment or drug treatment. And so,
but you've got the youth substance use on your list.
yes, because there is active work being done around adults, and there hasn't been a lot of momentum around youth. Jill?
And I also like, I do appreciate this, and this, we will add this feedback. So this, part of this is getting more feedback for what the community feels are concerns around health equity. So we can definitely add this feedback as part of community input.
Thank you.
Yeah.
Okay.
So,
okay.
I think Amber had her hand.
Amber had her hand raised. Yeah.
Thank you. I have two questions. One is the something that I don't see on there that maybe this is outside of the scope of this, but the lack of providers in our area, I feel like is a big equity issue. And are there any efforts to encourage providers to move to this area so that we have more capacity as our population grows?
mm-hmm. Okay. Thank you.
Mm-hmm.
And Lisa's, just so folks know too, Lisa's taking notes on this as well, so that all of this input will be added.
And then my other question was just I had the honor of being interviewed for the youth prevention. And I'm wondering, is that a piece of this? Are they related at all, or are they separate?
Yes and no.
Right.
Definitely, part of it is timing. We're doing both assessments, and so a lot of that work has also informed like how youth substance use became one of the top priorities, because there is a lot of work there. But I thank you for that and recognizing as well.
Yeah.
And that actually, when I talk about lack of providers, that is an area where I see, for youth substance use, there are not, and I feel like too, when I say providers, it's also access to, oh my gosh, I'm blanking on what I was going to say. Circle back to me. Let me think for a moment.
I think, Amber, one of your questions there, getting providers out here, a lot to do with that, which is difficult, is the lack of affordable housing as well. Lack of housing, period, to get providers out here. So that's a tough go on that one.
Absolutely. And I remember now, like specialty providers. So providers who, are narrowing in on youth, right? The substance use, for addressing that just for youth, like that's where they specialize. Mm-hmm. And so it's not just providers, it's providers that are going to meet the need, if that makes sense.
Yeah, so would you, so kind of looking at, so with the priority around youth substance use, like would one of the barriers to addressing that would be like not enough providers that have specialty, and then also that point of like housing for providers to come. So would that be an accurate kind of based on what folks are saying?
That's exactly okay. My perspective. Yeah. And just anecdotally, I have some youth that I work with that I have referred for substance use counseling, and they, to my knowledge, there's only, I think, one counselor that's available. And I believe that counselor does not have specialized training in working with youth. not to the level that I would like to see anyway, and nothing against that individual. They're a wonderful, skilled person, but it is frustrating to see a need that really can't be met in the way that it should be in an equitable manner.
And I'll just, I know Shira can't talk right now. So, and we're not going to kind of go in that direction right now, but I will just point out that this is also something that CBH is interested in. And so I'm sure that at some point Shira will, when she's able to, be able to share more information on that when we're not talking about the health equity plan.
Thanks, Lisa. Any more comments or questions?
So do these, I guess so we have a few questions, and I know that Lisa did send them out. And so for anybody else, like, do these priorities feel relevant and important to our community?
Linda's shaking her head no. So I think we know why.
Yeah, I
and
didn't want
Linda,
to take
is that because you want to see the housing piece?
Well, we have plenty of housing. It's
or
with the mental.
The houseless.
Yeah, they choose because of the drugs and mental health issues. Yeah. And a lot of them are seniors. I feel like we are ignoring our seniors as well. Yeah. Because we have family and childcare and youth. But the older, most of the homeless are older. And a lot of the mental health and drug use are causes. They choose to live outside of housing.
Yep, yes, they do.
We're totally ignoring that population.
Commissioner Thompson has her hand raised.
Well, I do. Isn't this an interesting discussion? I feel like I'm back home because I started in social work a long time ago and decided I wanted to work on those other aspects like housing and the economy and all that sort of thing. But back home with you all is interesting because when Linda talks about the unmet need and the houseless population, it isn't just in cities. The enclaves in the unincorporated areas, I don't know that it needs to be called out as a particular identified subset, but some of the most problematic issues for neighbors are when there's I almost want to call it a contagion of gathering of people in vans and tents and maybe around someone who has housing, but then a whole community of drug using, otherwise homeless people can accumulate there. And I don't know if that's in the scope of what you want to be focusing on, but I'll tell you, as a county commissioner, I get a whole lot of input from community members concerned about that, I would call them their refugees from urban situations. And they come to the rural areas and it's more and more challenging to get them interested and involved in service providers. And they can be all ages, but primarily a middle-aged or older demographic, I think, if what I hear is accurate as a reflection of reality. Thank you.
It's a good point, Commissioner Thompson. I'm living that experience right now every day in Seaside across from my business with the houseless camp in Seaside. So I see that every day.
Julia is raising her hand.
Julia, yes.
I just want to put a word in here as a mental health provider and talking to other private practice mental health providers in this town. We get so many more calls than we can even answer sometimes. I do my best. The other issue is then when we refer to CBH, people will say they're not getting a call back. And when Shira can talk to us, I would really like to have that conversation, what we can suggest to these people when they're saying they're not getting a call back from CBH. I have one person who their family members coming back to the town after leaving 5 years ago with a mental health break, and now they're coming back. They've been in treatment, been homeless, been in a lot of ways. They're stable now. They're trying to come back and get connected with CBH so they can stay stable, but they can't even get a call back. And so I know a lot of people are getting a lot of services from CBH. So I've heard that answer before. I'm just not sure what else to tell these people. So
Shira put in the in the chat. We track all our engagement calls and likely have evidence of our outreach if you ever want to follow up on what we have done.
okay, and just if there will be somebody I could tell these people to call. I don't know a lot of information. I do about one. I can have somebody reach out specifically, but it just seems, I know they do a lot. I'm not saying they don't, and I'm sure they're in the same situation we are. But just if there's somebody we can say, call this specific person, I think it could be helpful.
Shira says, who specifically are you saying aren't?
I don't think she can say the person's name. That wouldn't be appropriate.
One
But
person,
I do want to just echo what Julia is saying, the, capacity, right? Like all of the mental health agencies are just beyond capacity trying to meet all the needs. And I don't want to go down a different path here, but the policy changes that Care Oregon is making it so associate level mental health professionals will no longer get reimbursed and can no longer meet OHP clients' needs, just limits further availability and increases the capacity placed on CBH.
Shira put out that she meant population, not person.
Yeah, and I think
I'm specifically talking mental health.
I think to what Shira is asking in regards to the population is because they do have folks who are going to be, you have people who are looking for a mental health service. You have people who it might be a co-occurring situation where it's mental health and drug. You have youth mental health, and so I think that's where sometimes, trying to say call this person, it might not always be that person, because depending on the population that you're calling about, it might be a different individual. And so she also says that they have drop-in services in Seaside and Astoria, and they can come to the clinics without appointments Monday through Friday, 8 to 5. So I think, a lot of it to both your point and Amber's point as well is it comes down to capacity and trying to figure out, okay, who's the population that you're calling for, so that way we can get you in touch with the right person who's going to provide that service.
And I was specifically mental health. I just feel like there's more people calling and saying they're not getting callbacks. And Amber's right. I don't have specific information. I like the information I can give them. You can do the walk-in when that's appropriate. It's just very hard sometimes to know how to support people.
It can get very
and
disheartening.
Following up on what Linda was saying too, I think some of our homeless people really are challenged to get and maintain services, and then the homeless issue follows. And I think that's why that Esperanza Village is so powerful, because there's people right there that can teach them how to maintain services so they don't get in the cracks. It's a huge issue, but I just really feel like I get too many people saying I've tried to call CBH and not getting a call back.
I am wondering if there's a way to increase, not networking, that's not the word I'm looking for, but at CBH, if these people are calling the wrong team of people, then maybe there's some kind of mechanism that can be put into place where that message is getting to the right people, so that it's not the onus isn't put on the person seeking help, right? Because they took a step, and it can be sorted within CBH on who's going to reach back out. So if they are reaching out to the wrong team, they're not left in the dark.
So,
Okay.
yeah, thank you.
And so Jill, let me, sorry to interrupt, but just Jill, your plan is great. I'm thinking, I'm following up on what Linda's saying. The collaboration between the services, I think that's where sometimes people get confused when they think they're reaching out to the right person and they're not. And I think that's huge for a community-wide plan.
Thank you. And I think we could keep, I mean, I would love to hear more, but I do have to give the agenda back to our chair. But I do encourage you, I know that Lisa did send out the questions, but if you have any ideas, like how public health, right? Looking at the priorities or other things that you might think are more relevant or should be a priority in our community, like what is public health's role? What are some things that public health could be doing to best support that? And what does meaningful engagement of public health look like to you? And then we will keep you informed with how would you guys like us to keep you informed about the next steps with the plan? Just coming back to this to report, or what would that look like?
I think maybe coming back to report at our next meeting, whenever that's going to be, and if anything's like extremely important, that maybe just have Lisa send out an email to the group and to keep us filled in. I think that might work out.
Okay.
Yeah.
Awesome. Well, thank you guys.
Okay, we'll continue this discussion. That was a lively discussion. Yeah. So, yeah. Okay. Thank you, Jill. Appreciate it. And let's move on. Losing track here. Okay, let's move on to provider reports. And Shira, CBH, Shira has stated in the chat that if you have any questions for her, you can put them in the chat because she has laryngitis and she obviously cannot speak right now. So with that, we're going to move on to Lori, but Lori is not present, and Carrie Seals is going to take her place and chat with us. So Carrie, you're up.
Yeah. I don't know if you can hear me.
We can hear
sorry
you.
for my lovely office. I didn't quite make it all the way where I was intending to be. So pulled over and found a nice little park to sit at. Lori asked me to step in for her today. Not a lot to report on our end. We are Randy, as you know, is part of our DD advisory committee, and I'm really proud of the work that we're starting to do. We've developed some priorities for our community, and we'll start to meet with our subcommittees starting this month during our meeting, which is on the 14th. I'm diligently sending out a newsletter. It's not always super great, but I'm always happy to, if there's ever any information that you'd like, this team would like to get out to our community, please let me know and I can stick that in our newsletter. I just put in the chat a question about, Lisa, I know that we had talked about you coming to our next meeting, and then during our meeting, we decided to hold it as subcommittees. But if this is something you think that it would be appropriate for me to send out in an email to our population to solicit feedback, I'm more than happy to do that. I just sent out our newsletter this afternoon, and so I can send a little update and send those questions out if that's helpful. So please let me know about that. And I don't know, not really sure what else to report out, but things are going well. Any questions, please let me know.
Carrie, I have a question. Did we decide our developmental disability advisory group to have Lisa and Jill in next Wednesday?
Well, Randy, you're the only one that's responded so far. So if you get the vote, then I would say yes. I'm hoping that folks will be okay with that, just kind of gathering up for, I think, Lisa, you said about 20 to 30 minutes. I think that makes sense. And then we can all go off into our subgroups. I think that would be fine. I'm assuming, but I wanted to give folks a minute to respond. So I will let you know next week for sure.
Okay, there was two other members that did respond.